Welcome. My name is Tracy Bryce. I'm the Director of Marketing here at Mind Plus, and with me today is Dan Sylvester. He is the Director of Clinical Research. And during our workshop today, Dan will be discussing how Mind Plus Neurology is advancing migraine medicine. And we have time for Q&A at the end, but if you did have any questions along the way, feel free to pop in the chat and ask your question. I can see if I could interrupt Dan, or if we want to just collect them all and save them to the end, that's fine too. So that's all. So with that, Dan, take it away.
Hi, good morning. It's very nice being here with everybody today. So clinical studies, that is a very big deal. Clinical studies are also referred to as clinical trials. And what they are is it is an experiment designed to learn more about a medication, whether it's an existing medication or a new class of medication. And just because the drug and a lot of them are considered investigational, as we're going to be discussing some of the drugs that we are doing studies on, they are medications that have been FDA approved for other things, but they're just trying to get it into more classifications. The first study that I want to talk about that we are very proud to be doing is the Aurora study, not mentioned with Aurora Healthcare. They just call it the Aurora study. And this is for a new class of injectable, it's called a PAS2 inhibitor. It's kind of like your Emgality's and Ajovy's, but the next generation of that. And we have currently been doing screening. We were the first site in the world to do an injection, which was really very, very cool. And what that is it is a preventative injectable PAS2 medication designed to prevent headaches and migraines. Right now, the study is on a pause, so there aren't any further enrollees. But in the future, once that pause is made up, we are going to be contacting out. I'm sure many of you have gotten our questionnaires about headaches and migraines for those studies. For that study specifically, you need to be between the ages of 18 and 70, have tried multiple other preventative medications with no success or success, and then you come in to be screened. On a lot of these studies, a big thing is collecting data, which is headache diaries. So for every study that we have, you do an online headache diary. And what that does is it shows us the frequency, the severity, how often, how long the migraines are lasting with treatment, and that really helps us get the data. It is kind of, as we talk about more about studies, a lot of places do not just do migraine studies. We are very lucky here at Mind Plus to specifically do headache and migraine clinical trials. When we start talking about our pediatric study, there's a lot of children who see pediatric neurologists and they don't have the resources at their facility to do the study. So it is very cool that Mind Plus is kind of leading the way in all of the migraine research that is out there. The next study that we have is kind of a big one. One of the hardest migraines to treat is menstrual migraine. And we are working with AbbVie with the Mosaic clinical trial. And this has to do with Ubrelvy. Everybody's very familiar with Ubrelvy, but Ubrelvy is used mainly as a PRN or as needed medication when you do have a migraine. What this study is doing is taking that Ubrelvy and using it as a preventative just before your cycle and during your cycle. To be a part of this trial, you need to be at least 18 years old. And the first thing that happens is you do a screening. So we need 3 cycles, so about 6 to 16 weeks of information. Then you kind of come into the trial. And once we use your headache diary to kind of plot out when your cycle starts, we start taking Ubrelvy 3 days before the trial and 4 days during menstruation. And then we chart and we see if Ubrelvy is going to be effective with preventing those menstrual migraines. The great thing about this study is it is double blinded. So during the study, you might have the possibility of getting a placebo. But once the study's over, we go into what's called an open label extension for a year, which means that you get to keep using the Ubrelvy. You get basically free Ubrelvy that you're going to take with your menstrual cycle. And you can also use the Ubrelvy kind of for breakthrough pain. One of the hardest things with doing clinical medical trials are kind of the co-contaminant medications that you are taking while the trial is going on. Um, so with the Mosaic menstrual migraine trial, you're allowed to take opioids for pain. You're allowed to take your triptans as normal. You can use SSRIs or SNRI antidepressants where other studies don't. The only thing they ask for the Mosaic is to kind of keep in mind that we need one form of birth control. Extended cycle hormonal contraceptives are not allowed for the protocol, and no taking barbiturates like Fioricet is a very, very popular one. And also no CBD or cannabinoids, no marijuana. For all studies, they do ask that you are not getting any injectable preventatives or taking Botox. And a lot of these studies, if you are interested in doing them, it's best to just get screened. Call Mind Plus, ask to speak with me, and we will kind of have you come in. We'll discuss your medications. We'll discuss kind of the process of how all of these studies kind of go forward. The next one that is really kind of exciting is called the Periscope study, which is for children ages 6 to 11 and adolescents aged 11 to 17. Right now, CGRPs have really changed the way that PRN and preventative migraine treatment is moving forward in the past 5 to 7 years. But with Ubrelvy and most CGRPs, it's only available for those above 18. The Periscope study is wonderful because it's looking for the effectiveness of CGRP, specifically Ubrelvy, in children and adolescents. This is also a double blind placebo, so you might get the medication, you might not throughout the study. Um, how the Periscope study works is you have a child who has headaches and migraines. As long as you've tried Tylenol or ibuprofen or any other headache thing in the past, you are good for the trial. You come in, we set you up with a headache diary, and you have a headache within a 30-day period. You take the Ubrelvy, or the medication we give you. Again, it's a double blind placebo. And then you call us and we kind of move you into the trial where we see the effect of that one. We get lab values, we do EKGs, and then we give you more samples. Just wait for another migraine. The cool thing about this pediatric study is um, it's also open label. So a lot of children and adolescents cannot get Ubrelvy prescribed to them. Once they go through the screening process, the one migraine where you take either the medication or the placebo, you move into a open label exemption for a year where again you get to take Ubrelvy up to 8 times a month for your headaches and migraines. And the amazing thing about Ubrelvy and most CGRPs are they're very safe. Side effects are very limited. In the past, you would have people on triptans or other medications, and they would say that they didn't like the way that it felt or it didn't take the pain away completely. We're finding a lot of benefit with adults and Ubrelvy to where they prefer that over other PRN medications. So getting this going for the pediatric community and having a place where they can come to be a part of a trial to kind of change the direction and the shape of pediatric migraine treatment. For all of the studies that we have, the best bet is to give a call. Say that you are interested. You're going to talk with myself, and we'll go through medical history and see if the trial is a good fit. We'll get in for screening, and it's a nice process, and we try to make it go as easy as possible. So looking at all of the studies that we have, I mentioned that the first one, the injectable PAS2 medication that we have is on a pause, which means the pharmaceutical company is just pausing. We can't take any more screenings. The one for the pediatrics, we are hoping May 12th, around that time, to start signing people up. And the menstrual migraine towards the end of May, we'll have a date of when we can have people come and sign up for that study. Um, I'm going to open it up to questions right now, or if there's any questions that Tracy has to kind of move things along.
All right. I did have a question.
Yes,
So
yes.
I know that you mentioned it was double blind. So is there a chance that a patient would not be receiving the medicine, even um, in any of the cases?
For the Aurora study, the injectable one, there is a chance that you will just get nothing throughout the whole study. And with it being blinded, I wouldn't know. Dr. Boobles wouldn't know. Only select people of the team will know whether you're getting it or not.
Mhm.
Um, with the other two Ubrelvy studies, there is a chance that through the study, you will not get the actual medication. You'll get either a half dose, a full dose, or nothing at all. But the wonderful thing about the Periscope and the Mosaic study is after the study concludes, you will get the medication and you will be trying it for at least a year so that we can see what kind of progress you're making with that. So during the study itself, there's no guarantees. You're shooting at about 50-50. After the study on the two Ubrelvy ones, you will get the product at the end of the study.
That's really great. And then as far as understanding how it's working for the patient, there's documentation, right, that has to happen along the way?
There's a lot of documentation. You're gonna everybody gets EKGs, they get labs. Everything is looked at kind of with a fine-tooth comb, including the headache diary, which is the biggest part of collecting data, is the headache diary. And sometimes that really, people can say that, I think I'm better, but the diary is really an at the moment documentation of how they're doing, and you can see that that there is improvement with it. And it's kind of fun on my part thinking, did they get it, because things are looking better, and it's amazing when people start feeling better. um, Unfortunately, when it comes to the like at the end of the study, they can take years, so we won't know whether you got the placebo or not indefinitely for until the study's over, which can go for a few years. But we usually have a pretty good idea, which then kind of helps on the being a patient at Mind Plus. We were part of this study. We think this helped, and it can kind of, through that trial and error process, it's like, okay, we think you got this and it helped. It can kind of help drive further treatment in the future and kind of help with diagnosis and all of that for Dr. Boobles.
Mhm. So are these programs open for existing Mind Plus patients, or are we only enrolling patients who are not a part of Mind Plus already?
It's open to everybody. The cool thing about being a Mind Plus patient is when we have a study that comes up, we can look at our patient population. And I know that there's people who we've contacted being like, hey, this study is coming up. Your diagnosis and your particular circumstances are wonderful. Would you like to be a part of this? We also take people who just kind of hear about it organically and then screen them, get their medical records, and then take care of everything. And once the study is over, of course, we kind of transition into being a Mind Plus patient to make sure that we do get a handle on their headaches and migraines.
Mhm. Yeah, I think that that's really a kind of interesting way for a person to get to understand who we are, if as an introduction to be a part of the study and be a part of breaking ground on these new and exciting medications that could change the way we diagnose and treat patients into the future.
It
But
is. And it's also very cool where, especially with the pediatric study, what really has kind of caught me off guard is talking to other pediatric specific practices saying, we want to send our patients to you because we know CGRPs are safe, we know Ubrelvy is safe, but we can't prescribe this. to our pediatric
Hmm.
patients. So they're sending them to us, kind of the regional migraine facility, and being like, can you help them and put them through the study? So it's really cool to be in that situation where we can kind of help beyond where traditional healthcare kind of stops or where they are limited. We're kind of given that open door to test other things and the new wave of things coming through.
Hmm. As far as the pediatric one, how young can a patient be to start?
6 years old. Um, that one we kind of cut up into two groups between 6 and 11 to 17. But 6 years old is the youngest that we'll take. And with that, I think for most of the children, there is parental involvement. Of course, with consenting, parents are always going to be there. They're going to help their kids with their daily headache diaries. So it really kind of becomes like really just between Mind Plus and the family, a big team focusing on it and getting it done, which is a really cool thing. And a lot of children who have headaches and migraines, because of their age and what's FDA approved, that they're not really set for the more cutting edge stuff like the CGRP. So it's a really exciting thing to be kind of on the forefront of that when it comes to
Mhm.
pediatric migraine.
And you were mentioning the diary, and it is an electronic diary, right? It needs to be submitted online?
It's an app. You
An app,
come in,
an
we
app.
set you up, we download an app, and then we go over how you fill it out. Each study is just a little bit different depending on the medication, but it's very intuitive from what I've seen and what
Mhm.
people involved in our studies already have done. But that is such a huge thing on collecting data because it is a snapshot at the moment that it happened without hindsight or, it wasn't that bad the next day thinking about it, it's really a good tool and it's very easy. It's on your phone, or we can supply a tablet or a device.
Great. Um, so as far as compensation, do people have to pay to be involved in this
It is
study?
completely free, and the pharmaceutical company will pay you for every visit in telehealth. That there is a stipend amount. We don't have those set for it yet. There's a stipend amount for the injectable study also, and then that's including telehealths and all of that. The biggest thing, especially with the pediatric trial and the menstrual migraine trial, is the free access to Ubrelvy, especially after the trial is over. We supply you with Ubrelvy for you to take off label for a year. A huge plus to the studies is that access to Ubrelvy, which just in normal practice is a phenomenal medication. It's really been life changing and has changed kind of how headache medicine is taken care of in the specialty realm.
Awesome.
Okay, cool. I should mention that right now the studies are out of the Mequon campus. We do have people though, because these trials are, um, they're not everywhere for the injectable CGRP. We are one of 4 sites in the country. Um, People do travel very, very far to do the clinical migraine trials. But right now it's just out of our Mequon campus, but we try to make things as easy as possible with scheduling, going around scheduling. Sometimes if a weekend appointment needs to be made, that is something that we definitely do because it is a big deal getting people relief with medication and getting these studies going so that it's kind of open for the rest of the world and everybody and the other physicians to prescribe.
Yeah, absolutely. So the first one you were talking about, the Aurora study, that's a brand new injectable that probably doesn't even have a name yet,
No
but
name.
Ubrelvy is something that we have heard of and have been prescribing for years.
Yes.
So do you think, and you probably don't even know the answer to this, but do you think there's a possibility that could be fast tracked to being approved for a different way of using the medication? Because it's already FDA approved.
It's already FDA approved, um, but not. It's for specific diagnoses. When you think headache and migraine, people think that, you have a migraine. The migraine itself is not the diagnosis.
Mhm.
There's so many different diagnoses for a migraine because there's dozens of different types of migraines, different causes for the migraine. Ubrelvy is not currently FDA approved for menstrual migraine, and it's not FDA approved for pediatric migraine. So hopefully, once they do studies like this and they're like, hey, this is really effective for menstrual migraines or for pediatrics, because it's already FDA approved, hopefully you would hope that it would be cleared faster for use in that specific type of instance.
Yeah. So it's really almost just proving that it can work in a different way. That's already been proven to work. And
Yes, and it is a very common thing for pharmaceutical companies to do this. We have a lot of popular medications that started out like as blood pressure medications and ended up being used for vastly different things based
mhm.
off of the medical trials. Like, okay, this is a side effect of this, and then that kind of becomes the purpose for the drug. With these, they're already CGRPs are known and proven and just wonderful. So hopefully it would be a faster than the few years of brand new
Right.
medications. And the Ubrelvy ones are phase 3, which means they've been around for a while. Ubrelvy's been around a while. They're very safe medications.
All right. Did that spark any questions for anybody out there? You can feel free to unmute yourself or pop them in the chat if you had any outstanding questions we didn't cover.
I do have a question.
Oh, go for it.
Hi, Ashley.
Hi. I was wondering for the Aurora study, I don't remember if you said, is there any restrictions on meds you can be on currently with that one?
That one has the most medication restrictions. Um, I think what's best, and really, I'm happy that you brought this up because I wanted to make this point at the very end. The best bet is to call. Talk to me. We will kind of go over all your medications, your medical history in a non-public forum and see, if it's the right one for you. But that one is kind of a big consideration. For the menstrual migraine, there are a few medications that we did discuss that are kind of like no medications. But I think that that's kind of we talk about it, we'll call it a pre-screening where we talk about it on the phone. And then if we decide to move forward, we'll do just a normal screening for the trial. But there are medications that are on that list.
Thank you very much.
You are welcome.
Well, awesome. Thank you for asking that question. And thank you, Dan, for offering up all this information.
Thank you.
It's just an exciting time to be a part of this brand new medication and all of these new studies that are hopefully going to help shape the way we treat migraine into the future. So awesome to be a part of it.
It will. Cool. Awesome. Thank you for having me. And as always, everybody who knows Mind Plus, we keep everybody very aware of what's going on through emails, through our HubSpot, through social marketing. So you will hear about studies more, and feel free to reach out, ask to talk to me. We can go over what study you are good for. If you know somebody who might benefit from the study, please feel free to call and look for all of our wonderful marketing on it.
If you wanted to learn more about the study, you can call our clinic at 888-585-7975. And if you want to just learn more about it on our website, go to mindplusclinic.com. And there's more information there. So, all right. Thank you, everybody, for coming today.
Have a nice day, everyone. Nice seeing you.